Good morning, and thank you so much for joining us today. My name is Ursel McElroy, and I am the Director for the Ohio Department of Aging. This is a very exciting time in the state of Ohio, full of opportunities as we emerge from this pandemic. And although we are exhausted and sometimes disheartened by the devastation this virus has caused, we must not let off the gas. And we must take this opportunity, this time when older Ohioans who have been disproportionately devastated by COVID-19, to share our stories, share expertise, and advocate for moving Ohio forward. I am grateful for your attendance and for your interest in our budget priorities for the next biennium. And I hope you've had an opportunity to watch our testimony before the House Finance Committee on February 10th. That was a long day of great testimonies. And last Tuesday, March 2nd, before the House Finance Subcommittee on Health and Human Services. Also on Wednesday, February 24th, there were many associations that represent aging services that briefed the subcommittee as a panel, and they then received and responded to questions from the members. If you did not catch these events live, you can certainly read the testimony or watch the recording through the committee's web pages, and I encourage you to do so. For this session with all of you, today is not a repeat of my two testimonies. Today is my opportunity to talk plainly with all of you as members of the Aging Network or as interested parties of the Aging Network. We have, as you know, so much work to do, and helping leaders at all levels of government, from the federal to the local, appreciate the alarms that we're sounding and work collaboratively with us to evolve Ohio's system of aging. It will take all of us and all of them to achieve the Ohio that every older Ohioan and every future older Ohioan deserves. And will it take time? Yes, it will. Do we together have what it takes? I believe that we do. I want to talk about evolving Ohio's system of aging and how do we evolve this system and what does that mean? I'll explain the what and the how from our perspective at the Department of Aging. I encourage you, however, to ask yourself the same questions and determine what it means to you and your organization. I've had the pleasure to talk with so many of you, and I know that we are aligned and united in our images of this evolution. And so as we proceed now and for the next 2 years, we as aging advocates must band together and work as a united front for older Ohioans. And I absolutely believe this is possible because we have an appreciation for the continuum of care and meeting people where they are. So whether your mission is focused on early interventions or home and community-based services and supports or life in a nursing home, we know that there is great importance in each of these settings depending on the levels of need of those we're supporting. Our united focus should simply be to make each of these stages of support the best quality experience possible for our older population. And as we emerge from this pandemic, it is our time to truly rethink and reimagine aging services and what it means to Ohio. We must acknowledge the fragility of our system and work to comprehensively strengthen it. We must focus and talk about the importance of stability and capacity for each stage of need. We must support and justify the value of every stage of care, as all are critical to the health, care, and safety of those we're serving, as well as members of our families, our friends, and our neighbors. We must arm ourselves with all of the data and knowledge available to strategically evolve Ohio's system of aging. And today I'm pleased to share with you two very important tools to support that evolution: our biennium budget proposal and the Strategic Action Plan on Aging, or what you'll hear me refer to often as the SAPA. The Department of Aging state fiscal years 22-23 funding request was developed in a way that lets us evolve the system of aging, not just for this budget cycle, but for years to come. It includes person-centered care that supports healthy aging with equity, respect, and dignity. Safety nets which evolve with the system, and a strategic yet agile funding for complex statewide issues. We know we need to be proactive, but sometimes unpredictable situations arise, and we know all too well what a once-a-century global pandemic can do. No one ever imagined what life would have been like in the last year. But because we quickly learned to be agile with our funding, we shifted focus, rapidly developed programs, protocols, and systems that undoubtedly save lives. In short, the Ohio Department of Aging does not currently possess funding that enables us to address and resolve statewide challenges at the level we would like to. While we're fortunate to have the Older Americans Act and the Senior Community Services Fund at the state level, these funds are distributed throughout the state and consumed at the local level. We know that we have statewide challenges that require statewide attention and statewide strategic policy decisions and funds to support those decisions. We're proud that our statewide policy decisions have been so closely informed by all of you, and we know the challenges and we're committed to addressing them. You can also trust that our department will be working to build consensus with other states to advocate at the federal level to not only increase funds that directly serve our older adults at the community level and making sure the funding supports the standard of living for the workforce, but we will also be advocating for state level funding that can be matched to address our big systemic problems. Our federally funded programs provide this. Think about the U.S. Department of Transportation that provides funding, not only for the state's roads and bridges, but also for our interstates. It is time that Congress consider this evolution of the Older Americans Act. We need more and continued funding for community level services. And we also need this strategic level of funding at the federal and state levels to make these systemic changes. It is critical to serve and support people and to make these statewide strategic attacks on these systemic problems. We have to get upstream of these, and we have to do it now. So our new proposed fund, the Strategic Aging Investments, the title simply writes itself. And I hope this helps to explain the critical reason and purpose of this fund. The needs of older adults widely vary based on a range of social determinants and personal decisions. But no matter where someone lives, what race they are, or how much money they were able to earn, they deserve to age with dignity and access to all the resources available in Ohio. We make decisions because of people, not because of numbers. And for the next few slides, I want to take a moment to explain our services and the overarching challenges that we'll need to collectively address to strengthen and evolve Ohio's system of aging. If you saw my testimony last week, this is a new graph that we introduced. The purpose of this graph is to show that as we age, we can take two paths. And so that you follow along, one path starts on the left and one path starts on the right. The purpose of this graph is not to say that one stage of service deserves more attention or funding. Every stage of service deserves attention and funding because as Ohioans age, depending on a multitude of factors, all of these services are critical. What we know, though, is there are two common paths as we age, and these paths can correlate to the cost of long-term services and supports. The path on the left shows that many older Ohioans are healthy and active into their very late years, and good health can mean lower costs. The path on the right shows that health conditions, injury, social drivers of health, or personal decisions can accelerate and reduce mobility and independence and can lead to more costly care. We can, through our strategic efforts and our Strategic Action Plan on Aging, or our SAPA, shift the trajectory and timing of decline. It will be a great day when we in our communities have addressed the social drivers that can escalate and accelerate chronic and debilitating conditions. We all hope for this, our desired future state for all Ohioans and for ourselves, our children, and our children's children. Regardless of where a person is on these paths, we need to meet them where they are so that life is great in whatever setting they are in. Whether you're in a facility or in your home, if the system's services and safety are lacking, the system is not serving you well. Evolving Ohio's system of aging is also about evolving the systems and the safety nets. The win is not where Ohioans are aging, but how Ohioans are aging. It's a win when they are in the appropriate setting for their needs and care, and all of the safeguards and quality care practices are in place. So let's first talk about quality in our long-term care facilities. Regardless of what place an older adult was living, we know that this pandemic unfairly targeted them. Yet we also know that it has affirmed our challenge in congregate long-term care settings that contributed to more severe impact of this disease. Yet through the long-term care quality initiatives investment, we'll work to support and empower Ohio's long-term care settings and strengthening the safety and quality of their programs. We know that there are lessons learned and best practices that evolved during the pandemic, and we will use the best ideas to garner impactful and permanent changes. We'll work closely with the long-term care industry, along with the Ohio Department of Health and Ombudsman Office, to not only identify common deficiencies, but we'll work to understand the root causes of these patterns so that the facilities can achieve meaningful and sustainable improvements to strengthen care and safety of their residents. As Ohioans seek more community-based care options, the demand on the nursing home bed capacity is expected to remain steady. So we will continue to have unutilized beds unless we evolve. The Department of Aging, in collaboration with the Departments of Health and Medicaid, will launch a bed buyback program to purchase and retire the licenses for these beds. The goal is to encourage more single patient rooms and remove costly unused beds from the system. Recent reports show 18% of 86,000 nursing home beds are vacant. The state is proposing to appropriate $50 million to incentivize nursing homes to sell some of their vacant beds. This approach will offset costs on the state for paying for those beds, but more importantly, this presents us the opportunity to restructure an institutionalized care model. Removing vacant beds helps to incentivize single room occupancy, which greatly benefits residents in multiple ways, including the obvious, reducing double occupancy, which could reduce the spread of COVID-19 or other infection. It promotes residents' choice to live alone or share a unit if desired, and it can help improve the overall environment. And although Ohio has shifted more care into home and community-based services, nursing homes continue to represent the standard for long-term care for individuals requiring round-the-clock care that nursing homes provide. We are grateful for the roles that they perform in our communities to support those with the highest care needs. But this is an opportunity to help to incentivize more improvements. I'm going to talk a bit about our long-term care ombudsman program and its mission. Its mission is to advocate for excellence in long-term care services and supports wherever consumers live. And the ombudsman and certified representatives work to resolve problems and advocate for the rights of clients in home and community-based settings and residents of long-term care facilities. In fiscal year 20, we were able to invest significantly in the state long-term care ombudsman program. In fiscal year 20, funds were invested to hire a full-time volunteer coordinator in the central office, as well as one in each of the 12 regional programs. They also certified an additional 111 volunteers. And can you imagine for a moment what this past year would have been like without the ombudsman expansion in place? During the pandemic, they've been a critical lifeline to facilitate compassionate care visits for residents and families, and resolve thousands of concerns related to care and treatment. And now we see another trend, another need. and plan to be proactive once again. In fiscal year 22, the office will increase efforts to educate older adults and people with disabilities in the community, those who receive home-based care, about the role of the Ombudsman in assuring the delivery of needed services to enhance their quality of life. So I want to talk quickly about home and community-based services. And what do we mean when we say person-centered care? We've developed an incomplete or flawed logic that having a higher percentage of at-risk older adults living at home is a victory. In part it is, but if you consider when our home and community-based services programs were originally conceived and funded, the risk associated with continued independence were not. This is why, in addition to supporting our in-home care programs, we plan to strengthen Ohio's prevention and response to those perpetrators who take advantage of older Ohioans. And through the new proposed funding, we will work to strengthen elder protections for Ohio by developing programs and working collaboratively with law enforcement, prosecutors, county job and family services directors, and elder abuse experts. We want to strengthen protections by utilizing the year-round RAC Back program, which provides notification of criminal activity for as long as the individual is employed. And finally, we'll also create a certification program for our non-Medicaid providers who provide services funded by our department. This effort closes a gap by achieving certification across all programs, thus strengthening standards and excellence in the care and services they are providing to older Ohioans. In my testimony, I talked about the need for early interventions. And in the past few decades, there was a focus on rebalancing, a focus on Medicaid-based services and keeping people living in their homes or in the community for as long as possible. And at the same time, the funding remains stagnant for the very program that can keep an older adult healthy and keep them from declining. An older Ohioan shouldn't have to decline in health to the level of choosing placement in a nursing home or choosing wraparound services at home before receiving our helping hands. We are committed to changing or evolving our narrative of care in Ohio. If you choose a nursing home, you'll get top class care wherever you live. If you choose to remain at home, you'll get top class care with a high focus on restoring or retaining your good health. Much work will occur in this space as we continue to advocate for investments to serve people earlier, for upstream interventions, and for solutions that strengthen our workforce and make home care a great sustainable career choice for the worker. So how do we achieve this? We have a storm right now. Consider Ohio's population is aging, our workforce is shrinking, and our spending on care is growing and is not sustainable. We must invest in people sooner and smarter, and there are ways to do it. How will we achieve this? What is the strategy for the statewide aging initiative funding? And we present to you today the Strategic Action Plan on Aging, or what you heard me call the SAPA. The department contracted with the Health Policy Institute of Ohio to facilitate development of the summary assessment of older Ohioans and the Strategic Action Plan on Aging throughout 2020. We facilitated development of these documents with input from a multi-sector advisory committee of experts from around the state. The summary assessment of older Ohioans was released in June of 2020. And it provided a comprehensive picture of the health and well-being of older Ohioans, which informed development of the SAPA. The summary assessment builds on two data components: primary data findings compiled by the department in the 2019 through 22 State Plan on Aging, and this includes data from a stakeholder needs assessment survey and regional forum discussions, and an analysis of a prioritized set of approximately 60 secondary measures provided by the Health Policy Institute of Ohio. The data analysis in the summary assessment was designed to answer these key questions. First, What are the biggest health and well-being strengths and challenges for older Ohioans? Second, which factors that impact the health and well-being of older Ohioans are most important to address? And third, 6 themes emerge from the data findings, including transportation and caregiver support. What are those themes and how do we address them? A key finding from the summary assessment was that the opportunity to live a long, full life is out of reach for many Ohioans. Ohioans living just miles apart, both in urban and rural communities, experience strikingly different life expectancies. And when looking at average life expectancy at the census tract level in Ohio, there is a gap of 29 years between the tract with the highest and the tract with the lowest life expectancies. And by 2030, older Ohioans, those 60 and older, will account for more than a quarter of Ohio's population, up from 19.8% in 2010. Supporting healthy aging and valuing all older Ohioans in the face of this changing landscape is critical. And these findings, among others identified in the summary assessment, highlight that Ohioans in our state face significant challenges to their health and well-being, challenges that we will need a concerted effort across aging network partners to address. And that brings us back to the SAPA. The SAPA is a prioritized plan to advance elder justice and equity and achieve optimal health and well-being for older Ohioans. The SAPA lays a foundation to ensure that all partners in the aging network are rowing in the same direction to improve the health and well-being of older Ohioans. Having a document like the SAPA is important for many reasons, but one of the key reasons is that aging is a universal experience that should be valued and celebrated. Older Ohioans make substantial contributions to society, including working, volunteering, caregiving for young children or other family members, and serving as community leaders and mentors. And often these contributions go unrecognized and are uncompensated. The SAPA was developed with input from many different stakeholders, including 71 members of a multi-sector advisory committee and work teams, including subject matter experts from around the state. 19 key informants, including representatives of Ohio's area agencies on aging and organizations serving older Ohioans most at risk for poor outcomes. In addition to leadership from our department, we received input from the Ohio Department of Health, Department of Mental Health and Addiction Services, the Ohio Housing Finance Agency, Ohio Department of Job and Family Services, Ohio Department of Medicaid, and the Ohio Department of Transportation. The SAPA also builds on and aligns with these documents that are already in play: the Summary Assessment of Older Ohioans, the State Plan on Aging, and the State Health Improvement Plan, or what's often known as the SHIP. This is the conceptual framework for the SAPA, and it highlights SAPA's goal and vision at the top in green, the SAPA priorities in the blue and gray boxes in the middle, and the key SAPA principles in the red and orange boxes, advancing elder justice and equity. It provides a comprehensive roadmap for public and private sector partners to achieve the SAPA goal by prioritizing 15 issues across 6 topic areas to focus on in the SAPA. It tracks progress on 19 outcomes and 26 objectives. It highlights opportunities to advance elder justice and equity, provides a menu of evidence-informed strategies and resources to improve outcomes across issues prioritized within the document, and it outlines recommendations for data reporting and evaluation. It includes a strategy and resource section for each of the 15 SAPA issues. And these sections include a menu of evidence-informed strategies and a list of national and state-based resources that provide additional guidance and information on ways to impact SAPA issues. The SAPA goal is that all Ohioans live longer, healthier lives with dignity and autonomy, and disparities and inequities are eliminated. The vision is that Ohio is the best place to age in the nation, And this means ensuring that Ohioans live longer and extending older Ohioans' healthy and active years. Elder justice and equity are addressed in the SAPA through 4 primary ways. The first is by providing key considerations for advancing elder justice and equity. The SAPA includes overarching considerations such as creating an age-integrated society and dismantling systems, policies, and beliefs that devalue aging, and also provides considerations specific to strategy implementation within each of the strategy sections. Second, it identifies priority populations. The icons you see on the screen represent the different priority populations that were identified in the SAPA, either based on available data or through expert feedback. Third, it highlights strategies likely to reduce disparities and inequities. And then finally, by setting specific targets when the data is available, how we can eliminate those disparities and inequities. The final key component of the SAPA are a set of data reporting and evaluation recommendations. And there are recommendations included in the SAPA that are broad-based for public and private partners. And then we have recommendations specific to Ohio's area agencies on aging. Achieving the SAPA goal and vision will require collaboration among a wide range of public and private partners at the state and local levels. And this includes engagement across all state agencies and traditional aging network partners, as well as new partners within housing, food access, transportation, business, philanthropy, healthcare, public health, behavioral health, and community-based organizations, among others. State and local partners can act on one or more of the 6 action steps you see here. You can align with our work. You can advocate for funding and policy change, fund evidence-informed strategies, implement one or more of the evidence-informed strategies identified within the SAPA, partner and collaborate within and across sectors to improve SAPA outcomes, and you can help us to evaluate the progress on SAPA objectives and the impact of our SAPA strategies. For more information, we encourage you to read the full SAPA document and to review the SAPA quick guide. If you're like me, you just want to give me the highlights. And so for those of you who like the highlights, we've got a nice quick guide for you. But it provides a high-level compilation of SAPA priorities and evidence-informed strategies for easy reference. Both of these documents, the SAPA and the companion document, can be found at aging.ohio.gov/SAPA. I want to thank you for taking time today to join us at our webinar. I also would like to thank you on behalf of the entire team. We are quite energized by the opportunities that lie ahead. With the biennium budget and the SAPA, we have a clear path forward, and we know how to evolve Ohio's system of aging in a way that helps all Ohioans live longer, healthier lives. Thank you for joining us today.